Good morning and welcome to today's webinar entitled COVID-19 Respiratory Protection Guidance for Long-Term Care Facilities. My name is Brian Brocker. I'm a health and safety consultant with the PA Osha consultation program. The purpose of today's webinar is to provide an overview of the guidance for respiratory protection in long-term care facilities during the COVID-19 pandemic. The chat will be open during the webinar. If you have any questions, please submit them through that chat feature. If due to the nature or the technical nature of the question and a more thorough response is required, we will post the answer on our website within 7 days of the webinar. The webinar itself will be posted there as well for future review. This guidance is designed specifically for the nursing homes, assisted living, and other long-term care facilities, or LTCFs, as you'll see in future slides. For example, skilled nursing facilities, inpatient hospice, convalescence homes, and group homes with nursing care. One thing you want to keep in mind is this guidance is structured and focused specifically on federal OSHA enforcement states, such as Pennsylvania, and does not pertain those requirements set by state, county, or local governments. Federal OSHA only. Also, OSHA is currently working on a COVID-19 standard. It's going to be an emergency standard, and it could come out within the next month or two. So some things may change based on that standard, so you need to be aware of that. Long-term care facilities are different than other healthcare settings because they assist residents and clients with tasks of daily living in addition to providing skilled nursing care. Even though this guidance is intended for protecting workers from occupational exposure to COVID by the use of respirators, primary reliance on engineering and administrative controls for controlling exposure is consistent with good industrial hygiene practice and with OSHA's traditional adherence to the hierarchy of controls, which you can see in front of you. You can see the first thing you want to try to do is elimination, physically taking the hazard out of the work area. It's a little hard to do in this situation. Substitution, that's replacing the hazard with a new item, which is also difficult. Then we go to engineering controls. That's where you isolate people from the hazard or the hazard from people, barriers, guards, using ventilation, those kind of things. Administrative controls, this is where we change the way we work. The cleaning procedure we put in place, social distancing, not masking, but other issues. PPE is where we use the masking and respirators. And that's, as you see, is the least effective. Most effective the higher up you go. Therefore, employers should always reassess their engineering controls. For example, your ventilation systems and administrative controls. That's your hygiene, physical distancing, cleaning, disinfecting of surfaces and other areas. To identify any changes you can make to avoid over-reliance on respirators and other PPE. You want to take a look at CDC's COVID-19 web pages. I refer to this a lot throughout the webinar. This one I'm referring to as nursing homes and long-term care facilities. Engineering administrative controls are especially vital considering the current supply chain demands for N95 filtering face piece respirators. And you see that FFRs are filtering face piece respirators. You'll see in this presentation, this slide, one on the left there shows ventilation systems, which is an engineering control. We have air coming in through dampers from the outside into area C and into area B through more dampers, and then into area A, the contamination zone, through more dampers. And then the air is sucked out through that same room directly to a filter bank and then a fan or something to take it to the outside. That's a typical engineering control for that kind of area. The other one, it's an engineering, but it's more in relation to social distancing. It's a little machine that can go around, a computer operated machine, and tell you, hey, you're getting too close to each other. It's high tech, more for a process than it is for considered engineering control, but I threw that up there anyway. Additional control strategies for preventing exposure to SARS in long-term care facilities can be found in OSHA's COVID-19 guidance for nursing home and long-term care facilities workers. Also in CDC's nursing home and long-term care facilities. There's two good documents where a lot of this information is derived. Respiratory protection guidelines for COVID-19. Even when control strategies are in place, PPE, including respirators, will be needed for workers when close contact with someone is known or suspected having COVID-19 cannot be avoided. And that does occur in nursing homes from time to time. Whenever respirator is required, employers must implement a written worksite specific respiratory protection program, or RPP, going forward here. This includes medical evaluation, fit testing, training, and other elements as specified in OSHA's respiratory standard, which can be found under 29 CFR 1910-134. Other requirements that are related for under OSHA are the eye protection, protective clothing, which can be found under OSHA's 29 CFR 1910-132 for the PPE standard, and specifically eye protection standard under 29 CFR 1910-133. Which kind of coincide with respiratory. It's other protection that you want to take a look at when doing your COVID compliance. Face mask coverings, or face coverings, I'm sorry. Face mask authorized for use as source control by the FDA. FDA cleared or authorized surgical masks and respirators. Those are three topics we're going to review now. There are multiple products or devices that can be used during the COVID-19 pandemic to cover a wearer's mouth and nose. It is important to select the right one for the situation. These products, devices can provide source control, and some of them are also considered PPE, which will protect the wearer as well. Source control refers to the use of a product or device to cover a person's mouth and nose to reduce the spread of respiratory secretions and aerosols when the person is breathing, talking, sneezing, or coughing. I guess they're laughing and yelling as well. Because of the potential for asymptomatic or pre-symptomatic transmission, source control measures are currently recommended for everyone in healthcare facilities, including long-term care facilities, even if they do not have symptoms of COVID-19. Healthcare providers should wear source control products or devices at all times while they're in a long-term care facility, including break rooms or other spaces where you might encounter other people, including coworkers or residents. Source control products or devices should be appropriate for anticipated exposures, and they would include such things as cloth face coverings. These are homemade or commercially available products made of cloth that cover the nose and mouth. So make sure it's nose and mouth. Cloth face covering should not be worn instead of FDA cleared or authorized surgical masks if protection against exposure to splashes or sprays of infectious material or others is needed for like bloodborne pathogens. The cloth face coverings do not provide effective respiratory protection for all workers when protection against airborne hazards is needed and do not fall under the respiratory protection standard. They are not considered PPE for the wearer, but can assist in source control. More on cloth face coverings. Long-term care facility patient and visitors should wear their own cloth face coverings upon arrival and throughout their stay at the facility for source control. If they do not have a cloth face covering, they should be offered a face mask, surgical mask, or cloth face covering by the long-term care facility, as long as supplies allow. More on face masks. These products look similar to and are often mistaken for surgical masks, but do not provide fluid resistance. That's your bloodborne splashes. They do not provide effective respiratory protection for workers when protection against airborne hazards is needed, and they do not fall under OSHA's respiratory protection standard. They're not considered PPE for the wearer, but can assist source control. I a little bit redundant on some things to get the point across. The FDA, not OSHA, has authorized emergency use of face masks, including cloth face coverings that meet the criteria for use as source control by the general public and healthcare professional in accordance with CDC recommendations during the COVID pandemic health emergency. An example of this would be your KN95 respirator with ear loops instead of a head strap that has not undergone the rigorous fit testing requirements of other N95 respirators to demonstrate proper fit and seal for the wearer's face. FDA cleared or authorized surgical masks. As you can see pictured there, it's a little bit different than a cloth mask. Surgical masks are cleared or authorized for emergency use by the FDA and are jointly regulated under OSHA. Under OSHA, you have the PPE standard 29 CFR 1910-132, but also under the bloodborne pathogen standard 29 CFR 1910-1030. An FDA cleared or authorized surgical mask, when available, FDA cleared authorized masks are preferred over cloth face coverings for healthcare workers, as they do offer both source control and protection the wearer against exposure to splashes and sprays of infectious materials. They do not fall under OSHA. Again, they do not fall under OSHA's respiratory protection standard, as I mentioned in the slide before, PPE standard and bloodborne, because they are loose-fitting devices that do not provide effective respiratory protection for workers when the wearer might be exposed to airborne hazards. They don't meet that criteria. Respirators. This would be including FDA cleared and authorized surgical N95 respirators and surgical mask N95 filtering face piece respirators. Healthcare providers who are close contact with residents in a long-term care facility with suspected or confirmed COVID-19 or SARS-CoV-2 infection, they must use a NIOSH approved N95 floating face piece respirator or equivalent higher level protection respirator. Again, that's listed under 1910-134. When protection against exposure splashes and sprays of infectious material from others is also needed, an FDA cleared or authorized surgical N95 floating face piece respirator must be worn for healthcare workers. And then again, that's under 1910-134 and 1910-1030. Surgical N95 respirators must provide the same level of respiratory protection as an N95 respirator. However, the surgical N95 respirator meets the FDA requirements for fluid penetration, flammability, and biocompatibility. And that's listed in the 21 CFR 870.4040B1 for future reference. OSHA regulates respirators on the respiratory protection standard 29 CFR 1910-134. In order for a respirator to provide the expected level of protection, it must be used in context with respiratory protection program. For additional information, the CDC interim infection prevention and control recommendations for healthcare personnel during coronavirus pandemic will be covered in a later slide for that. Employees can refer to the OSHA Small Entity Compliance Guide for Respiratory Protection Standard for better understanding of OSHA's Respiratory Protection Standard. The guide includes step-by-step instructions for compliance with the standard, with checklist and commonly asked questions, as well as sample written protection program, respiratory protection program. The key element of a respiratory protection program is that employers must implement when any of their staff are required to wear respirators, including a program administrator who oversees all elements of the respiratory protection program, This can be an infection prevention and control practitioner or a nurse administrator, your call. If there are no staff members suitably trained to be program administrator, consider hiring a local industrial hygiene consulting service to help establish a written program for you. Or you can contact OSHA's on-site consultation program. That'd be us. We can help you with that as well. You want to implement and maintain a written respirator protection program that details worksite specific procedures and elements for required respiratory use. For example, medical evaluations, fit testing, training, maintenance, and certain program elements may also be required for voluntary use respirators in use in order to prevent potential hazards associated with the use of a respirator. So that would apply as well. Okay, one of the first things you want to do is conduct a risk assessment to identify which workers are at risk of exposure to any airborne hazard. That includes SARS, COVID-2, or COVID-19, tuberculosis, TB, Legionella, certain hazardous chemicals you may find in your workplace. Such workers would include any staff, whether clinical or not, in close contact, would be less than 6 feet, with residents with confirmed or suspected COVID-19, for example, during bathing, dressing, toileting, and direct clinical care. Clinical staff performing aerosol generating procedures, for example, respiratory therapy, open suctioning of airways, or other issues such as that. Cleaning staff, maintenance staff, visiting practitioners, that'd be physicians and physical therapists who do not normally work at your facility, would also be included. When classifying your risk of COVID-19 or SARS-CoV-2, OSHA has divided the job task into 4 risk exposure levels, as depicted here below here, and it's the occupational risk pyramid for COVID-19. Excuse me. You have very high, medium, and lower risk. You're going to want to put your categories or your employees and/or procedures in each one of those categories. Now I'll go through some examples of each of those now, or just the definition of each of those. Very high exposure risk jobs with high potential for exposure to known or suspect sources of COVID-19 during specific medical, postmortem, or laboratory procedures. Workers include healthcare and morgue workers performing aerosol generating procedures on or collecting, handling specimens from potentially infectious patients or bodies of people known to have or suspect to have COVID-19. High exposure jobs with high potential for exposure to known or suspect COVID-19, sources of COVID-19. Workers in this category include healthcare delivery, healthcare support, medical transport, mortuary workers exposed to known or suspect COVID-19 patients, or bodies of people known to have or suspected of having COVID-19 at the time of death. The medium exposure risks require frequent or close contact with people who may be infected but are not known to or suspected patients. Workers here include those who maybe have contact with the general public, example, schools, high population density work environments, high volume retail settings, including individuals returning from locations with widespread COVID transmission. A lower risk are jobs that require contact with people known to be suspect of being, or not require contact with people known to suspect of being infected. Workers in this category have minimal or occupational contact with the public and coworkers. Okay, part of the respiratory program would be to implement procedures for selecting an appropriate type of respirators for the hazard, whether the infection agent, SARS, and/or hazardous chemical. The program administrator would be responsible for identifying which type of respirator is suitable based on the hazards, workplace factors, and user factors. You can see over here where this here is actually for agricultural respirator, but same idea for selecting different types of respirators for different needs. Also, in OSHA's small entity compliance guideline for respiratory protection, it can be a useful tool for this selection as well. My mouse wasn't working. These here are the different respirators you can look at. Okay, so you want to select from a NIOSH approved respirators and be cautious of counterfeit respirators, which often come with commercial marketing during pandemics. Employers can access NIOSH's approved N95 particulate filtering face piece respirators and counterfeit respirator misrepresentation of NIOSH approved to determine respirators models that you're considering NIOSH approved. So these two documents have what's approved and have information on counterfeit products. This goes back to even a couple of slides ago. This is a good slide that shows you look at what your operation you're performing or task you're performing, and what hazard you're protecting against, and then you have disposable and reusable respirators. And this particular one, this happens to be a 3M one I pulled up, and this one here, they highlighted the ones that their specialists prefer. That's just, every manufacturer has a guide like this that you can go through and pick the respirator that best fits your situation. Okay. As you know, these times our supply chain is limited. So during pandemics, when there's an increased demand and decreased availability, you have a high supply on N95 filtering face piece. So you want to consider all alternatives to N95s, including such things as P100s and N99s, reusable elastomeric or rubber type respirators, and PAPR is powered air purifying respirators. Now, the initial investment for elastomeric respirators and PAPRs may be greater than for an N95. And purchasing these types of respirators can often lead to cost distributions. In addition, the loose-fitting power air purifier PAPRs do not require fit tests, which can lead to further cost and time savings for employers. Some more resources here. More information on advantages and disadvantages of elastomeric respirators and PAPRs. During COVID, CDC has 2 documents there: elastomeric respirators, strategies during conventional and surge demand situations, and then CDC's considerations for optimizing the supply of powered air purifying respirators. When choosing your respirators, you want to choose eye and face protection that can be worn safely together with the type of respirator you've chosen. So you want to take care to ensure that the eye and face protection will not interfere with respirator seal. Another part of the respiratory protection program is you want to implement procedures for performing medical evaluations of workers required to use respirators, determine their ability to safely wear a respirator prior to needing to wear one in the workplace. So you want to make sure they're physically fit to wear that respirator, because it can cause some strain on your ability to breathe. You want to identify if physicians or other licensed healthcare professional, that's what PLCHP is, to conduct a medical evaluation and maintain confidentiality. Because under HIPAA, you want to keep these private. And you also have fit testing. You want to ensure that workers using a tight fit respirator, an N95 floating face piece respirator, is fit tested prior to initial use, whenever a different respirator size, style, model, or make is used, and at least annually thereafter. Passing a fit test is important because it ensures the size, make, and model of the respirator can provide the proper facial seal to offer the expected level of protection for the person using that respirator. And when doing your fit test, you want to ensure that you're following OSHA's approved fit test protocol, which you can find that on 9 CFR 1910-134 in Appendix A. It's a whole section on fit testing, different protocol for that. So another note, because of the usage and availability, which I want to get into more of that. OSHA has some other guidelines on exceptions to the rule. But if you're having difficulty obtaining commercially available fit testing solutions required for some of the qualitative fit test, because of limited supplies, you can refer to OSHA's and NIOSH's guidelines where you can prepare your own solutions for qualitative fit testing. Also, you could consider switching to a quantitative fit test protocol. And third, you could also contract with a reputable occupational health clinic or consultant that provides fit testing services. Another part of this respirator protection program is to establish procedures and schedule for maintenance, storage, and storage of respirators used for more than a single use. For example, procedures for cleaning, disinfecting, storing, repairing, discarding. Another note is that while the N95 floating face piece respirators are meant to be discarded. I'm sorry, they're supposed to be discarded after each use. The CDC has developed a contingency and crisis strategies, including reuse and decontamination of N95 floating face piece respirators to help healthcare facilities conserve their supplies during these shortages. And I'll talk about that a little bit later in the webinar as well. They have documents you can refer to help assist to see what's available, and I'll get to that. The last element of the program, written respirator program, is training. You want to provide effective training to workers required to wear respirators. And it should be conducted in a manner that is understandable to workers, meaning that your training program should be tailored to the education level and language background of your workers. If they don't understand you, they're not going to get it. And that training should cover how to properly put them on and take them off, how to conduct proper user skill checks, how to recognize respirator hazards in the workplace. You want to understand the limitations and capabilities of the respirators, and how to recognize medical signs and symptoms that may prevent or limit effective respirator use. And you also want to ensure that they can demonstrate the knowledge to safely and correctly use the respirator. Part of the overall program is you want to conduct periodic evaluations of the workplace to ensure that your written respirator program is being properly implemented and that it's up to date. Some places may have had programs in place already, but through this pandemic, you're going to make some changes based on the things I'm covering today. You want to ensure that workers are using their respirators properly, and you want to solicit input from the workers. And if you have a union, you want to use union representatives to provide feedback on the program. So in light of the next area is some temporary enforcement discretions related to the respiratory protection standard during COVID-19. So OSHA put out some new guidelines and areas for covering with the pandemic, and I'm going to go over some of those now. In light of the essential need for adequate supplies of respirators during COVID-19 pandemic, OSHA has temporarily allowed for some enforcement flexibility regarding respirators, including certain fit testing provisions, the use of respirators that are beyond their manufacturer's recommended shelf life, extended use and reuse of respirators, the use of alternate respirator certified under the standards of certain other countries and jurisdictions, and decontamination of respirators. This is described in detail in various temporary enforcement memoranda, which you can find on OSHA's website. See down there that under their COVID-19 portion of their website. The OSHA inspectors or field officers will exercise enforcement discretion concerning, this area is on fit test provisions. I'm going through each one of those provisions now, and the first one is the fit testing provisions. So they're going to give discretions on citing you for the annual part of the fit testing. That's covered under 29 CFR 1910 134 F2. What you want to do is you want to make a good faith effort to comply with that regulation. You want to use only 9R certified respirators. You want to implement CDC and Osha strategies for optimizing the supply of N95 filtering face piece respirators and prioritizing their use. You want to perform initial fit tests for each healthcare provider, which has the same model, style, size respirator that the worker will be required to wear for protection against the COVID. Remember, initial fit testing is essential to determine the respirator properly fits and workers capable of providing the necessary protection. So that's why the initial one is still required. The annual one is the one that they're exempting you from temporarily. In addition, for fit testing, you want to inform the workers that in order to forego the annual, you want to inform the workers that the employer is temporarily suspending the annual fit testing and N95 floating face piece respirators in order to preserve the supply of respirators until the situation is no longer necessary. You want to explain to workers the importance of performing user seal checks or fit check every time you put it on, and to make sure they're getting adequate seal in accordance with those procedures outlined in 1910-134. It's Appendix B. It's a user seal checks, and I think Osha also has videos on this as well. You want to conduct fit tests if they observe any additional fit tests, if they observe any changes in employees' physical condition, such as facial scarring, dental changes, cosmetic surgery, or obvious changes in body weight, and explain to them that their face shape has changed, and since their last fit test, they may no longer be getting a proper fit, so you need to get a refit on that. You want to remind workers that they should inform supervisors or the program administrator, however you have it set up, if the integrity of the N95 filtering face piece is compromised in any way. Okay, now another area they have enforcing discretion is the extended use of respirators or expired respirators. And this is for all employers. In the event the extended use of N95 filtering face becomes necessary, the same worker is permitted to extend use or reuse of the respirator as long as the respirator maintains structural and functional integrity. The filter material is not physically damaged, soiled, or contaminated. Again, you have blood on it, or if you're using it to paint, get paint on it, it deteriorates it. FERS must address in the written respirator program the circumstances under which a disposable respirator will be considered contaminated and not available for extended use or reuse. And this is what I mentioned earlier, continually updating your respirator program. This is a new protocol you put in there, and it may be temporary and go away in a few months, hopefully. The extended use is preferred over reuse due to the contact transmission risk associated with donning and doffing your respirator. You're touching everything. Continue on that same area. When a respirator is reused, you should have a particular, you want to make sure you pay particular attention to the storage and make sure the filtering face piece is stored properly between uses. You're not smashing it up, bending it up, putting it in contaminated areas. The user shield should be formed each time you don the respirator, and should not use a respirator if you cannot perform the seal check. If it doesn't, you still have a leak, don't wear it. You should train workers to understand that the structure of the functional integrity of the part of the respirator is compromised. It should be discarded, and that is a successful seal cannot be performed. Another respirator should be tried to achieve a successful use or seal check. You can use the exact same type of respirator, but it'd be a new one. If reusing is necessary, an appropriate sequence for donning and doffing procedures should be used to prevent contamination, and training should address the appropriate donning doffing procedures. And continue on expired respirators, extended use. In the event that the N95 filtering face piece is is not available, the employer, and as long as you've shown good faith to acquire the respirators, you can use alternative measures. The inspector has discretion. Again, they have discretion on this area. Employees may only use previously NIR certified expired N95 respirators found to be effective. Workers should be notified that they're using expired N95, so you want to make sure you notify them. Whoever's purchasing protective equipment should not commingle products that are past their recommended shelf life with ones that are within their shelf life. So keep them separated. You should visually inspect or ensure that the workers the employer should make sure the employees are visually inspecting their N95 floating face piece respirators to make sure the structural functional integrity of the respirator has not been compromised. And over time, components do wear out. The straps stretch, nose bridge gets weak. There's foam material under it, it degrades and disappears, and that'll affect your fuser seal. When the employer has expired N95 respirators available, they're in your own cache, example, not from the U.S. Strategic National Stockpile, the employer should seek assistance from the respirator manufacturer or independent lab regarding testing of those stored respirators prior to use. So that's using yours versus the strategic stockpile. Now, regarding extended use expired respirators for healthcare employers only. And this doesn't apply to the general industry. Expired N95s generally must not be used when the healthcare provider performs surgical procedures on patients infected with or potentially infected with COVID-19, or perform or present for procedures expected to generate aerosols or procedures where respiratory secretions are likely to be poorly controlled. For example, cardiopulmonary resuscitation, CPR, intubations, extubations, bronchoscopy, and nebulizer therapy are some of the examples of that. The CDC has guidance for optimizing the supply of respirators. Employers should prioritize the use of N95 respirators by activity type. When a healthcare provider perform or are present with aerosol generating procedures, and respiratory secretions are likely to not be controlled very well. Use respirators, including the N95 filtering face pieces first. Other filtering face pieces, non-disposable elastomer respirators, and power purifying respirators that are still within the manufacturer's recommended life is recommended. You should use those first for those type of people, as long as they're available. Another category is respirators certified under standards of other countries or jurisdictions. So in some circumstances, additional supplies of respirators certified under standards from other countries or jurisdictions may be available. During periods of shortages, such as what we're in, the N95 floating face piece, the federal government advises that floating face piece respirators, air purifying, elastomeric respirators, and compatible filters certified under the following standards for other countries will provide greater protection than surgical masks, face masks or other surgical N95s, homemade mask or improvised mouthpiece or scarves. You can list, I'm not going to go through each of those, but where you can look them up to see what's certified as the country, the make and model listed right there. So certification in accordance with the standards ensures that devices provide similar filtration as NIR certified equipment, as described in tables 1 and 2 of the Osha enforcement guidance. And you can see that's the long guide. The enforcement guidance for use of respiratory protection equipment certified under standards of other countries or jurisdictions during the COVID coronavirus disease, 2019. Occupational Health Administration. So they have, these guidelines are listed there. And due to the impact on, that next one is decontamination of filtering face pieces for respirators in healthcare. So of course, due to the impact on workplace conditions caused by the limitation of supplies, you should reassess your engineering controls, your work practices, and administrative controls to identify any changes that can be made to make the decreased use of respirators. However, if the respiratory protection must be used and acceptable alternatives are not available for use in accordance with OSHA's previous COVID-19 enforcement memoranda, NIOSH has identified through available research that suggests the following methods offer the most promise for decontaminating floating face piece respirators. That includes your vaporous hydrogen peroxide, ultraviolet germicidal irradiation, or moist heat using water heated in an oven. These methods are not available. You can microwave generated steam or liquid hydrogen peroxide can be used. You should not use the following methods unless you have sufficient demonstrated the safety effectiveness method to become available. As of the developing of this, these were not approved methods. Autoclaving, dry heat, isopropyl alcohol, soap, dry microwave irradiation, chlorine bleach, disinfectant wipes, regardless of impregnation or how much it's saturated, ethylene oxide, and the document has this information in. The NIOSH evaluated research provides a justification for each of these methods, for not using each of these. So in order for OSHA to exercise enforcement discretion, this is for all the categories I just went over for their discretion, you must demonstrate that and document that you've made good faith efforts to comply with the OSHA standards, as outlined in the OSHA's memoranda, which summarize understanding compliance with OSHA respiratory protection standards during the coronavirus-19 pandemic. That's one document you can refer to there. OSHA's temporary enforcement memoranda are time limited, so this will go away. So if the COVID-19 goes away, it should go away. And they're aligned with CDC strategies for optimizing supply of N95 respirators, which recommend a variety of conventional, contingency, and crisis capacity control strategies. Enforcement discretion applies only after you, the employer, has considered and taken all possible steps to comply with measures in a particular control strategy. The long-term care facility employers should periodically refer to the OSHA's COVID-19 webpage. It has the most up-to-date interim and temporary enforcement discretion memorandums guidance. So as they update those, and they may have changed them tomorrow, so you want to keep looking at them regularly. In general, you want to keep in mind that there are specific requirements in each of those enforcement discretions. But basically, you want to cover, make sure you have a good faith effort to comply with 1910-134, that you assess the ongoing engineering controls, work practices, administrative controls, and suspension of non-essential activities, partitions, restricting access, cohorting patients, proper ventilation, relocation, moving things to other rooms or outdoors. Keep assessing those as you go. You want to document all that. And then you want to document any effort you have to comply, include your supply list, vendor availability, and attempts to obtain supplies. And then finally, you want to train employees in your efforts and the changes made, and instruct them that this is all temporary. And again, I mentioned before, update your written program to address these temporary changes. I think I might have these slides backwards, but I'll use it as is here. That's pretty much our presentation for today. If you see here on our website, it's our home website. It's actually an older one here. We have a new category. We have a COVID-19. You'll see will be, the mouse isn't working. Will be located up here. I should copy the newest one. But on here, you can find a lot of information that will help you, whether it's COVID or other related. You can sign up for a newsletter. You can request services. Down at the bottom, you can see a free consultation request form. View past webinars. View Osha video VTOLs. Focal point series. It's short videos, compliance topics. We also have a link to our partner, the PA Department Bureau of Workers' Compensation. They run the PATHS program, who we do a lot of work with, as well as other resources. Yeah, yes, I did switch those two around. But if you go on, you can see on here at the top of that previous page, we do have this new one, Safe Return to Work, COVID-19. We have a full, and it scrolls down through. We have a full list of, and it's related to OSHA, so we pull a lot of it off the OSHA site, CDC site, et cetera. And we compile it into different categories on here to help you find information for safe return and COVID compliance. So that's available to you as well. Wasn't working. So if you're interested, you can contact us. There's our information. You see our phone number, our website. We also have information posted on Facebook and Twitter. So you can help see us there and get our information out. Other than that, that is our webinar. We thank you for joining us. Our next webinar is how to reduce your EMR and impress your boss, March 10th at 10:30. Thank you again for attending, and goodbye.